Hello everyone, this is Dr. Aditya Gupta, your pediatrics faculty at DBMCI 1. So in this video, I just basically wanted to talk to all the aspirants who gave this year's NEET PG and are now thinking that they should probably prepare for November INI-CET also. There's a very good chance that counseling might get delayed, happens every year, or your expectation with NEET PG result is not up to the mark and you are thinking of giving November INI-CET a shot. In both the scenarios, I think one really good resource you can use or a product that you can use is a test and discussion, especially the DBMCI test and discussion. And I don't say this simply because I'm a faculty at DBMCI 1. I say this as someone who, as a student, also has used the DBMCI test and discussion. All right. So myself, when I 7 years ago, so this is a screenshot of that video. 7 years ago, when I got a rank, All India rank 17 in the AIMS PG, that time it was AIMS, it was not INI-CET. But yeah, I myself had used this test and discussion. I personally have been a big believer that test and discussions definitely help, especially as far as INI-CET is concerned. So in this video, over the next 3 months, how you can use the DBMCI 1 test and discussion, the online, or if you want to join the offline batch, that's also available. How you can utilize it properly, all right, and what strategy you can use, and how you can get the best possible rank as far as November INI-CET is concerned. I'll make more videos as far as November INI-CET is concerned. This video is specifically how to use the test and discussion, all right. So the best advantage of a test and discussion, what is a test and discussion? Let's understand that. It's basically, name itself is telling you, you'll have regular subject-wise tests all the way up to your exam till the November INI-CET, all right. And every test will be followed by a discussion from which you can make notes. This obviously will not be a full-length, regular class kind of discussion. It will be a kind of a truncated discussion, but it will definitely cover the most important points as far as your exam is concerned. The best thing that I personally loved about test and discussion is it takes away one major aspect from your mental capacity of your mental that causes mental exhaustion. It takes away all the problem of scheduling. The test and discussion gives you a schedule. I used to love this. All right. So over the next 3 months, let's say today is August 8th, 9th, and the exam is on November 9th, if I'm not wrong. You have exactly 3 months now, exactly 91 days. You need 3 revisions. You need what? You need 3 revisions. From August to October, you need 1 revision. In October, you need 1 revision and a final 7-day revision, a final last week revision, which I always emphasize. Now, what this test and discussion will do is it will give you a schedule. All right. So let's say the test and discussion starts tomorrow. It's going to start on 10th of August, right? Starts tomorrow. So, okay, over the next 2-3 days, I have to do ortho. Then I have to do radio. Then I have to do whatever the test schedule is. Then in the next 3-4 days, I have to complete pharmac. Over the next 3 days, I have to complete pedia or forensic medicine, toxicology, so on and so forth. Now, what you have to do is that over those 3 days, you have your own notes. Whatever notes you have used, rapid revision note, main notes, you made your own notes from during MBS, whatever notes that you use as far as the NEET PG preparation was concerned, revise those notes over the next 3-4 days. And you can easily revise those notes in 3-4 days. Practice all the important previous year questions in those 3-4 days and give the test. That test itself is a 50 to 100 MCQs. It's an MCQ test. It will test how you're able to apply those notes, how you're able to apply that knowledge. It's an MCQ based exam at that point. After that, it will be followed by a discussion. Now, this is the most important part. You have to make notes from that discussion. You will get PDFs, but I would advise please make handwritten notes because handwritten notes stay in your memory for longer. At least that's what I used to do. Now, in those 3 days, that subject is complete. In those 2 days, that 2-3 days, or maximum 1 week, that subject is complete. You gave 3-4 days for, let's say, pathology. You revise your notes of pathology. You solve the previous year question. You gave a test curated by the faculty, and now you have made notes from that. All right. These test and discussion notes for the minor subjects and for subjects like pediatrics and for subjects, first and second prof subjects, along with important previous year question and explanations, which you can bookmark, suffice. Only for the major subject, that is medicine, surgery, obs, gynae, these notes will not suffice. You would have to, ideally you would have already done them from NEET PG, concise them. That's it. That's a very simple, straightforward way to crack INI-CET. Over the next 2.5 months, follow the test and discussion schedule, make notes. And these notes, then you revise over the last 7 days. In the run up to the test and discussion towards the test, you have to solve the previous year questions of INI-CET. INI-CET anyway is very PYQ heavy. You all know that. All right. So you have done the previous year question in the 3-4 days, done the notes, PYQs, and you now have a discussion notes. Right. So when the last 7 days comes, when these last 7 days are going to come, you will do what? You will just do the TND notes. along with the PYQ explanations, If you revise this and give the exam, trust me, you'll get a good rank. This will work for around 10 to 12 subjects. For the 6, 7, 10 subjects I told you, like medicine, surgery, PSM, Ops, Gynae, and maybe a little bit of anatomy. You need to do anatomy and I'll talk about how I have to prepare for INI a little bit. Maybe for 5, 6, 7 subjects you need to go a little bit more, but for most rest it will suffice. You've given a test, you've done the discussion, you've understood what your lacunae are, where you're lacking. Online faculty has taught you where you might be lacking probably, right? And that's it. So myself, the paper that I'll make as far as this INI-CET is, my test is on 10th of September if I'm not wrong. It is going to be INI curated one. A mix of INI and EPG, but mostly INI curated one, so that you know what the important topics of INI is, right? So this is how you can use test and discussion. This is how I use test and discussion, right? So goal is very, very, another important thing that you all will also get access to Marrow Q Bank and the Marrow test series. So that's a plus. So you can use that for the previous year questions. You can use it for solving the important modules at least. If you were, so this is a very simple plan. This is the very simple plan that I will say. From August till October 10th, I would say, do test and keep on doing the subjects. One revision in October 20-25 days and one final week revision of your TND notes and previous year question and give the exam. You would have revised the main notes also in these 2 months, giving you broad depth, and these 2 months would have been the very fast revisions that give you the final push for the exam. Tomorrow, I will come on the DVM-CI1 channel. So tomorrow at 9 o'clock in the night, I will come at the DVM-CI1 channel. I'll give the link for the tomorrow's discussion also, where I'll solve all the doubts, even more doubts, a proper Q&A or one-hour Q&A, how you can use. But this is how I feel you should utilize the test and discussion. Use a test, use a schedule, prepare, give the test, make the notes. Use these notes plus previous year question explanations for the last 7-day revision. Nothing can stop you from getting an exam. You're getting a good rank as far as INI is concerned. I'll talk about how INI is different from NEET PG, what are subjects to be focused more, how to plan your revisions also, last 7-week revision in the coming videos over the next 3-4 days. I'll do that also, but this is a brief but a most important discussion on how to use test and discussion. Alright, I hope you enjoyed the video. Thank you and have a nice day.